Hello and welcome. I'm your host, Neil Howard. Glad that you could return for another segment of Health Professional Radio. In this segment, we're going to be speaking with Dr. Daniel Crowley. He's joining us here from Delta Dental of California and affiliates to talk about Delta Dental's Senior Oral Health Report, Older Americans' Oral Care Regrets, Barriers, and Impact. It was revealed that Americans aged 50 and older wish they'd gone to the dentist a lot more when they were younger, and some other key findings as well. Welcome to Health Professional Radio, Dr. Crowley. Thank you for taking the time.
Hi, happy to be here.
Well, tell us a bit about yourself and what it is that you do at Delta Dental of California and affiliates.
Sure. I am the Chief Dental Officer for Delta Dental of California and our affiliated companies across the country. I'm responsible for the quality of care delivered by the network, the very extensive network of dentists that are contracted with Delta Dental, and responsible to make sure that that care is high quality and that we're providing access to care so that people can get healthy.
What prompted you to go into dentistry?
You know, I always had a strong sense or urge, to go into like a healing profession. And for a long time, I thought about going to medical school. And after some soul searching and comparing, different health professions, I really felt that dentistry and really specializing in oral health kind of suited me more. There was more interaction with people directly on a day-to-day basis, on an ongoing basis, and you establish a very, very long-term relationship. If you think about your relationship with your dentist, typically there's a level of connection that you have with your dentist. And this is kind of like who I am as a human being. I love connectedness. I love health. I love instruction. I like helping people understand how to get healthier. And that just all really congealed on the dentistry field. It's a great profession. And if you're looking, please consider taking a look at the many careers, whether it's dentist, dental hygienist, dental assistants, or even office staff. There's a lot of great options in dentistry.
I'm going to go ahead and speak for everybody. Throughout our lives, we've all seen the commercials. We've seen the advertisements, the documentaries on dental health. It would seem that dental health would be at top of mind for everyone. It's one of the most prolific messages that's out there. Take care of your teeth, or buy this product, get that product. Even when you go to the dentist, there are so many options out there for dental care. Yet, many people neglect to take care of their teeth adequately and are very, very unaware of the health ramifications with other systems of the body when your dental health isn't up to par.
That is so true. And when we were here at Delta Dental, we were looking at like the aging population. And we realized that there was a very, very big gap in understanding as well as just the perceptions of going to a dentist by the population. A lot of times when we in the health careers think about prevention or eliminating disease, we go straight to children. And this population is the least likely to go to a dentist. They're the least they have the least access through health benefits. For example, core Medicare doesn't cover dentistry. So, we decided to take a closer look at the aging population and oral health to get a better understanding of really what's going on in thoughts and feelings and behaviors. And like you said, we hear it all the time, yet our survey results found that 72% of those that are over 50 actually wish they had taken better care of their teeth. We have this rule around here, the 2-1-2 rule. Brush your teeth twice a day, floss your teeth once a day, go to the dentist twice a year. And that's kind of a general rule to follow. But when you think about that, you hear it frequently on television and radio when you see those ads that you were talking about. But our survey results found that 80% don't go to the dentist as recommended, and 34% of those aging Americans hadn't been to the dentist in over 2 years. And I think those two kind of like foundational facts kind of led to this, I think, kind of like shocking finding that 2 out of 5 aging Americans smile less than than when they were younger. And while there's a lot of reasons to smile less, we ask the specific question around the appearance of their teeth. 2 out of 5 people don't smile as much as they did because of the appearance of their teeth. And as a matter of fact, we dug a little deeper into that and found that their feelings were around, they felt like they were going to be judged based on the appearance of their teeth. That's just kind of a sad fact that, we in the dental health career are really trying to address. Over time, there are ways to make sure that you don't fall into that category.
Is it a common misconception that, you need to take care of your teeth when you're younger, in your teen years, and that if you do well in taking care of your teeth then, that when you become older, your teeth will remain intact?
That is 100% not true. The bacteria in your mouth, just like all parts of your body, there are good bacteria and bad bacteria. And when all of that bacteria falls out of balance, the bad bacteria can feed on the sugars and can be influenced by medications that you take and start to develop diseases in your mouth. And, beyond cavities, we think about cavities a lot. You don't want cavities. You don't want those to develop. You don't want those to, extend and create pain. Certainly we want to take care of those. Beyond that, you can develop what's called either gingivitis or periodontitis, gum disease, or diseases of the bone in the mouth. And those diseases can start to actually erode the bone in your mouth and make your teeth loose or even come out. And it is developing those good habits when you're young and maintaining those good habits throughout lifetime that are going to keep your teeth healthy and in your teeth and gums healthy and in your mouth. And it's important to not only develop those habits, those oral health care habits for the longevity of your teeth, but the state of and the health of your gums and your teeth can actually contribute to your systemic health as well.
Is there any way to reverse the process or get my smile back on track?
Yeah, absolutely. It's never too late. I think that's the really good news story here. It's never too late. All of the diseases are restorable. All of the things we're talking about here, whether it's decay, you could go to your dentist and have that decay removed and restored back to health. Whether it's through fillings or crowns, to replace the function of a tooth, or if you're missing teeth, there are some really good solutions. Take advantage of those. And, I'd have to give in my dentist card if I didn't actually say, if you don't have a dentist, please find one. They'll make recommendations and then work with you on how to restore your teeth back, your teeth in your mouth back to health. And I think again, just kind of reiterating that good news story. It's not too late. Go. There's no shame. The dentists have seen it all. Believe me, they've seen it all. So go and take ownership of your own oral health. Go to your dentist and then start talking about some of those connections. One of the interesting connections. We tend to segregate taking care of your mouth from taking care of the rest of your body. And one of the goals that I have is to make sure that we're educating everyone that they're connected. There's correlation between your oral health and systemic health. Over 60 diseases have been identified with some of the same inflammatory factors and bacteria that exist only in the mouth. And so it's really important not only for your oral health to maintain those practices and keep your teeth and gums healthy, but it's important for your entire systemic well-being, and then jump even beyond that. If we talked about 2 out of 5 people smiling less, think about the impacts that can have on just your well-being and your mental health. If you're smiling less, if you're feeling judged based on the appearance of your teeth, you may isolate. You may not find yourself engaging with others. You may isolate, not want to go out. And that can start a negative spiral around self-doubt, And so there's a whole lot of impact that just developing simple habits to take care of your teeth can actually impact.
Well, doctor, if you would give us a website where our listeners can learn more and find out more about Delta Dental's Senior Oral Health Report, Older Americans, Oral Care Regrets, Barriers, and Impact.
Sure. There's a lot of great information, both about the study that we performed as well as some other oral health and aging documents at www.dddins.co/healthy aging.
Daniel, I appreciate your time this morning. Thank you so much. Hopefully you'll return and talk with us again.
Absolutely. Glad to be back. Glad to come back whenever you want.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Daniel Crowley. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download, and subscribe at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.